Blood in the semen, which is a rare, very rare issue, which is seen in the males, but for those who has seen blood in the semen, it's a frightening issue. They get worried, and most of the times this happens in the night and they don't know what to do. They rush to hospitals, and this is not an emergency issue, and most of the senior specialists or urologists, they won't be available in the corporate or any hospital at night, so you don't have to worry. Blood in the semen is not an emergency issue, but it's a chronic issue. So we can differentiate these issues into two types. If there are only few drops of blood in the semen or a small streak of blood in the semen, then this blood is coming from the urine pipe. So somewhere there can be a small tear in the urine pipe during the intercourse. This we don't have to take any medication. Generally take enough water, it will heal automatically. But if the entire semen is mixed with blood, or semen itself is in red color or dark brown color, then you have to worry. That means it's a chronic infection in the seminal vesicle, which is a semen reservoir, and this is a long standing infection. There you have to identify the cause, you have to identify the root cause for this, and then you have to treat it. This may take long time, but this has to be treated. Don't neglect. And most commonly people think that the blood in the semen is a sign of prostate cancer, but it's not true. Very rarely prostate cancer can cause blood in the semen, and most of the youngsters, they come to us when they see blood in the semen, they are worried about prostate cancer, and they say, doctor, one of my family members has prostate cancer, so is this a sign of prostate cancer? That is the common fear most of the young people have. So only thing to remember is prostate cancer is very rare in youngsters. Generally all these cancers, prostate cancers, they start after 50 years, so you don't have to worry. And prostate cancer is a very slow growing cancer, so it doesn't affect young people, and it doesn't affect people who ejaculates regularly. So that means if you are ejaculating regularly, generally the chance of getting prostate cancer is very rare. So keep ejaculating regularly. It is good for infection. It is good for, that means even if there is chronic infection, ejaculating regularly will help us. And there are many people who have a myth thinking that ejaculating frequently will make them weak. It is not good. People with chronic infections in the prostate or seminal vesicle have to ejaculate regularly. That is the treatment for them. Particularly, this is particularly for unmarried males. They have to ejaculate. This is the treatment. Whether you take antibiotics or not, you start ejaculating and then start antibiotic.